Hi everyone, I will be discussing the summary of the impact of medication error administration on nurses. According to medical malpractice lawyer in Scoburg, Ontario, several persons received undiluted doses of the Pfizer COVID-19 vaccine while receiving their booster shots at the Scoburg Medical Clinic. According to the report from CTV News Toronto from late January, the dose is equivalent to six times the suggested dose when taken undiluted, as this may result in several damage to the patient's status. So, what are the causes of medical errors? Number one, workloads. This activity entails in preparing, verifying, giving drugs, and updating the patient's electronic charts, especially in hospitals with many clients to handle with one or two nurses on duty. Number two, forgetting about the 10 rights of drug administration. The person giving the medication must use the drug correctly by adhering to the doctor's order. The intended use of drugs is to improve a person's health. Third one is not double checking the identity of the patient. Due to staff shortage, nurses sometimes overlook the patient's identity on the computer. Um, that can lead to wrong administration of the drug. So, what can nurses do to prevent medication error? According to Salar 2020, nurses should act professionally, should read the drug label carefully, pieces of training about giving medication, and awareness of the legal problems when error occurs. The second one is presenting technical strategies, knowing the risk of the medication, keeping the medication separate, and skills in administering the drug. So, what is the impact of change in nursing practice? Nurses can only implement this if they want change, as this will start on their own and with the guidance of their nurse leader. Many nurses still do not want change because it will alter their routine work, and they are also afraid of the effect of the change on them and the whole organization. However, in order to lessen the incidence of a medication error, they need to comply with this change. For the expected outcome, this will decrease the incidence of giving the wrong medication to another patient. Nurses may still make pharmacological mistakes as a result. However, they can lessen the likelihood of the incident if they act professionally and exhibit a professional attitude towards the system. This is a good indication that working positively can increase the level of care for the patient. CNA entails that good leaders will ensure that strong, dependable, experienced leaders who can motivate others and promote professional nursing practice are needed in the nursing field. They can plan what to do with their followers with this kind of leader. To maintain their goal, they might give or provide seminars to advance their education and pursue degrees like a master's or PhD. For that, they can further elaborate in their fields and continue to provide their patients with high quality care. That ends the summary of my Capstone project for nursing leadership and practice, and here are the references that I used. Thank you so much.